My friend DJ had an idea back in 2008, in the age of Facebook groups when they were really sort of at their peak, to bring people together around this topic that simply writing love on your arm wasn't enough.
Nothing is going to get accomplished from this. Like, okay, you're just words, you have no actions tangible to stopping or reducing suicide ideology and removing the stigma surrounding mental health. But I also thought this is an opportunity for us to all be able to do more.
And so the context at the time was that, largely speaking, stigma was still very much keeping people from seeking help and really sort of pushing the conversation down at that point in time yet. But it was starting to slowly, because of social media and the ability to communicate with larger communities outside of your own, there was an opportunity to talk about mental health. There was an opportunity to share information and resources like never before. And DJ's idea really was at the time to focus on sort of what are ways we can pay it forward or inspire action to get people involved in a very simple and meaningful way.
We really wanted to help teens and young adults who were suffering from mental health issues and suicide ideologies, and the greater communities who are struggling so much to discuss topics that at that point in time and even still now are just incredibly taboo.
At this point, we know that suicide rates are growing at unprecedented rates. We're seeing the highest rates of suicide for this age bracket for young adults in South Dakota and also the surrounding region, to the tune of about 30 to 40% increases over the past 25 years. You have to ask yourself, what are we doing to ensure that their lives are healthy, that they're able to pursue their life, but more importantly, keep them here? That's really what our work is about.
We were able to get together. We made a student organization at the University of South Dakota.
It was high energy, kind of fly by the seat of your pants, but really passionate and really engaged in what our work was. At times, probably considered ourselves to be superheroes. You know, we're gonna save the world. We're gonna save everybody.
The stigma around mental health is reducing. People are talking about it more. People are seeking resources more, and that's awesome. But in that space, universities don't have the resources currently to deal with that. We really focus in on providing that support and that peer-to-peer support and that network and that connection to resources and training and programming.
We always talked about, between Eric and I had ideas, and he was the one who really made sure these ideas came into fruition. And as you can see, under his leadership, Lost&Found has only continued to grow 10 years later.
We've grown the number of campuses that we serve, and we've grown the number of students that we serve on those campuses too.
I think one of the biggest components and strengths that the organization has is the relationship that we have with students. You know, we had those same personal struggles with mental health in college, and that really makes us relate to the struggles that kids go through.
We've also introduced the research piece that allows us to get a better understanding of practices on campuses and of students and how students are doing on campuses, so that we can design better programming to support students in campuses and communities.
You know, the funding for Lost&Found is all from private donations, and as the years have progressed and Eric has gone out and actively solicited corporate donations, we've gotten hooked up with several large-scale donors from the private sector that have really launched what we can do as an organization.
That funding source now has created this massive movement and ability for us to actually increase that impact and increase our ability to fund necessary staffing and necessary programs simply by just giving us the capacity to do so. The reason that we focus on resilience as an organization is to unite people around the idea that we all struggle, we all face challenges, we all navigate difficulties, but the kicker is we can all learn how to navigate.
Our message and our programming really needs to get out to students in every state.
My vision and the vision shared by our board and staff is to be able to serve every young adult in the United States. The idea that we can spread to every campus, that we can share this message of resilience and hope to every campus we can is something that we are united behind. We are compassionate.
We are inclusive.
We are responsive.
And we are here.